One of the worst kept secrets in the emergency medicine world is there are very few desirable EM physician jobs remaining. And I've spoken with many recent graduates who confirm a lot of their classmates are having trouble finding a job. And based on the data, it doesn't look like it's going to change anytime soon. And the results of this year's emergency medicine match are likely a big time I told you so from a not insignificant amount of emergency medicine physicians in the field. It's expected that in less than 8 years there will be a surplus of over 10,000 EM physicians. In this video we'll talk about how we got here, what some people are suggesting as solutions, and what I believe to be the only solution, at least in the short term, to the problem that my specialty now faces. Emergency medicine has been the fastest growing medical specialty in the last 50 years, which on the surface sounds great, but there has been an increasingly vocal concern about the proliferation of emergency medicine residents and residencies that are being created, and the obvious supply and demand dilemma that it's inevitably going to create, or as some people like myself and many others are saying, has already created. These concerns are written in articles and expressed in data that is easy to find on the internet and is usually prominently displayed in the throwaway articles that we get on a monthly basis. Articles like this one that talk about the disappointing match that was exactly what emergency medicine needed. Please stop building emergency medicine residency programs. Has the supply of emergency physicians exceeded demand? After years of calling for more emergency physicians, emergency medicine finally finds itself with way too many. Stop the madness and bring back droperidol. Okay, I know it's not related, but I really wish they would bring back droperidol. And on a side note, the backs of these papers used to be filled with job listings. So much so there was even a state directory at the beginning of each classified section. Now there are no listings. Except this posting by Penn State, which has been running for so long, I really feel like the paper forgot to just stop running the ad. At its most basic, there is now a supply and demand problem among emergency medicine physicians and the desirable jobs they thought they would be able to obtain after graduating from residency. And before we get into these fine details that I believe confirm these points, let's consider the total number of US hospitals over the last few decades. And why is this important? Because that's where ER doctors work. Without emergency rooms, you don't need emergency medicine physicians. But as you can see in this graph, in 1975 there were 7,156 US hospitals, and that number has steadily declined over the next few decades to 5,524. So keep that in mind as we discuss the next few statistics. Since the late 1970s, you can see a steady increase in the number of emergency medicine residency programs. And if you zoom in on the 1980s and 90s, you can clearly see essentially a linear increase in the number of programs. Now let's take a look at the past few years and the exponential growth that has occurred. In 2008, there were 148 emergency medicine residency programs supplying 4,565 residents a year. That number grew in 2019 to 247 residencies supplying 7,940 residents a year. That is a 74% increase in the number of EM physicians being trained annually during a time when the amount of hospitals and emergency rooms that are out there is decreasing. Now there is certainly a lot of finger pointing that can go around when you try to figure out how emergency medicine ended up in this quagmire. Obviously the easiest thing to do over the last few years is to lay this problem at the feet of the COVID pandemic, because you can clearly see based on the time frame when these trends began to occur, this all started before the pandemic even began. It doesn't take a gifted detective to ask the question, who was responsible for the creation of these programs when all the data point to a surplus of physicians being created? And to answer that question, let's look at HCA and other for-profit hospital systems. HCA has 186 hospitals and is the largest hospital system in the United States. They are a for-profit, publicly traded healthcare company that has a fiduciary responsibility to maximize profits for all of its stakeholders. And what is one way to maximize profits? You minimize labor costs. Now, HCA can't depend on overseas cheap labor like big tech companies and manufacturing firms, but they can overproduce labor, which would drive down the demand for emergency medicine physicians, which of course would drive down physician salaries, because why would a hospital pay a premium and justifiable emergency medicine salary when there are 10 other emergency medicine physicians who are unemployed, willing to do the job for cheaper because they have student loans, other debt, and a physician lifestyle that they're trying to establish? Is this a tactic that HCA is deliberately doing? Who knows? But since 2017, HCA has created 14 new emergency medicine programs, creating 150 students each year. And don't misinterpret what I'm saying. This is truly a case of don't hate the player, hate the game. HCA isn't doing anything illegal, except of course that time in 2003 when they had to settle with the Department of Justice the largest case of healthcare fraud in history for $1.7 billion, but that's not the point of the video. And HCA is not the only company doing this. There is US Acute Care Solutions and other for-profit companies that are doing the exact same thing. And there's of course other ways to drive down operating costs, which I'm sure they're doing, but that's not the focus of this video. It is clear that resident physicians can provide cheap labor, and it does make you wonder, have these healthcare companies truly become interested invested in high-quality physician education over the last few years? Or are they just answering to their fiduciary responsibility, like I mentioned earlier, to their stakeholders to keep the profits as high as possible? And before we go any further to look at the proposed solutions to the problem, let's look at one additional key piece of data from back in 2016. This was published in the Journal of Emergency Medicine. It's a study titled The Emergency Medicine Workforce, Profiles and Projections. Again, this was in volume 50, issue 4 of the April edition of the Journal of Emergency Medicine, and there are two key takeaway points from this, keeping in mind that this study was done back in 2016. In the conclusions, according to the authors, the data show there remains a shortage of board-certified emergency physicians, but it is decreasing every year. So all the way back in 2016, it was known, according to this study, that the demand for emergency medicine physicians was already on the decline. And one other key point in this paper is they write, "We project that within the next 5 to 10 years, there will be enough board-certified or eligible emergency physicians to provide care to all patients in the U.S." So back in 2016, there's data that show within 5 years, maybe 10, there are going to be enough physicians. So it stands to reason that maybe a linear growth of emergency medicine residencies might not be terribly unreasonable. But surely there's no justification for an exponential growth, and apparently that's what happened. And if you look at a very similar study that was performed just 2 years ago, titled the United States 2020 Emergency Medicine Resident Workforce Analysis, the number of emergency medicine residency programs has increased, with most new programs being added to states that already had enough emergency medicine residency programs. So in 2016, we knew we were going to have enough physicians when we got here. Unfortunately, we continued to create too many emergency medicine physicians, and now there are not enough jobs in urban environments where people actually want to work. So now let's take a look at some of the solutions that people are proposing. A physician named Dr. Thomas Cook, who also has been very vocal about this and has routinely reported on this in articles in the emergency medicine news, has written, along with a few of his colleagues, a few solutions they perceive to be feasible. The first solution they mention is to raise the bar to ensure consistency across emergency medicine residency training. Raising the bar among training, I get it, but it kind of implies that the bar that was set when I and previous generations came through wasn't high enough. And maybe I'm too prideful, but I kind of like to think that it was. So I don't know that that's the number one solution. To expand the reach of emergency medicine to ensure that no community is left behind. They talk about supporting practicing physicians to encourage rewarding practice in all communities. It makes sense, but the problem is, if it was easy to get emergency medicine physicians to practice in rural communities, that would be done already. And support is already being provided by government-granted loan forgiveness programs in underfunded communities, and we're still in this situation. Another aspect they talk about is ensuring the appropriate use of nurse practitioners and mid-level providers, and that is a loaded can of worms that I'm not even going to begin to discuss in this video. They offer a few other solutions like broadening the scope of emergency medicine, and ensuring that business interests are not superseding the needs of educating the workforce. But the problem is, I don't think any of those are going to solve the problem, certainly anytime soon. And in this article written by Gina Shaw, when she quotes Louis Ling, we would need to cut about 1,000 residency graduates a year, which gives you an idea of the kind of supply that we have. All those proposed solutions, which I think some could work, aren't going to work anytime soon, and according to the data, we need something that's going to work a little bit faster. And unfortunately, I believe there's really only one rapid and sensible solution to the problem. And since I don't see recently opened emergency medicine programs that have invested all of this resources, time, and money, and some of them have received a lot of money, to just up and close the program, my solution is to, and I get no joy out of saying this, but to discourage pre-medical and medical students from pursuing a career in emergency medicine at this time. Students considering a career in emergency medicine need to understand the upcoming employment landscape and the potential ramifications on the lifestyle that they are expecting. If you're graduating from medical school with at least $300,000 in student loans, expecting to make a certain salary, expecting to live in a certain part of the country, you need to know that based on the data right now, that's not going to happen. If the supply of emergency medicine candidates decreases over the next several years, it will force the ACGME and residency programs that have recently been opened to make some tough decisions. And while I don't wish any ill will toward anyone working in academic emergency medicine, especially in recently opened programs, the closure of some of these programs is probably necessary. Do you remember that Saturn car company a while back that was created by General Motors? General Motors had no business or need creating a new car company. And years later, when times got tough and they had to cut costs, they cut the company that they had no business creating in the first place, Saturn. I suspect something similar will happen. If time gets tough for residencies, the ACGME will cut programs that probably shouldn't have been created in the first place. If being an ER doctor is all you've ever wanted to do, then do it and you will likely be happy. But keep in mind, right now, it's a lot like opening a coffee shop in between two Starbucks in Seattle. You might want to go where the business is a little bit better.